Hey, what's up guys? Jared Beckstrand here, Doctor of Physical Therapy, ToneandTitan.com, talking today all about low back pain and sciatic nerve pain, specifically one of the reasons why you get it, and some simple stretches and exercises that you can do to hopefully feel better. Coming at you right now. Alright you guys, hey, thanks so much for joining me today. I'm excited to talk to you guys about sciatica, about degenerative discs, about stenosis. I hope this helps a lot of you guys out. I'm stoked that you're here. Quick plug for my channel, if you haven't done so already, I hope you hit the subscribe button down below. I try to share a lot of great tips like this. I hope I can help you guys out. Now, before we get too far into this, it's important that I mention to you that not all low back pain is created the same. Not low back pain comes from the same sources. Depending on what the source is, I'm going to treat it differently as a physical therapist. And so today, I'm actually shooting this video in response to a video that I shot a couple of weeks ago. This video today is going to be specifically about degenerative disc disease, stenosis, and sciatica due to those issues. Now, if you're looking for help with a bulge disc or a herniated disc, sciatica due to those symptoms, I would actually treat it completely differently than what I'm going to show you today. And so what I'm going to do, I shot a video for those things. Again, if it's a herniated disc or a bulge disc, what I want you to do is click on this link right up here. There's a little link that'll take you to that video. I'm also going to leave the link in the description down below this video. Those are the things that I want you guys to do for a bulge disc or a herniated disc. Today we're going to talk a little bit more about a degenerative disc condition. Again, treated completely different, so click those links depending on what you need. Now, okay, so degenerative disc, let's get into it. I brought my spine model out to help you guys to visualize this one. So our vertebrae column is a series of bones that are stacked one on top of the other, and they're separated by these vertebral discs. Now, the discs, the purpose of the disc is to create some mobility so we can bend, forward and backwards, we can bend side to side, and we can also rotate. Our spine is super mobile. It's also a way that it's going to add some shock absorption, while we're, running, jumping, walking. It's just a way to create a little bit more of, again, just a shock absorption for those forces. Now, the discs are very aqueous in nature. That means that they're water-based. And when we're younger, we have 100% of disc height, meaning that those vertebrae there's a good separation to those vertebrae. And you can see that the important thing to mention there is that these yellow parts right here, these yellow plastic parts on this model, those are all spine nerves. Now those spine nerves exit out each of your vertebrae. It's actually a joint between two vertebrae that kind of create a hole in the side, and we refer to that hole as a foramen or a vertebral foramen. Now the space on that foramen is directly related to the height of your disc, meaning the higher the disc, the bigger the hole that nerve can exit out of. Now, in the case of degenerative disc disease, or DDD, what happens is basically as we get older, our discs lose their ability to retain fluid. And so they kind of dry out, if you will. When they dry out, they flatten out. And so where we're used to having, 100% disc height, now maybe we have 80% or 70 or 60 or even 50% disc height. Some of them, really bad cases, there's no disc height there whatsoever. The problem that generates is now all of a sudden where we only have 50-60% disc height, now we only have 50-60% of that whole diameter through which that nerve can pass. And so with the shrinking discs comes the shrinking hole. That shrinking hole, that's the condition that we refer to as stenosis. And that's where as soon as that nerve starts getting bugged, as soon as that hole starts to pinch on that nerve, that's what causes that numbness, those tingling symptoms down your leg, even that pain that we refer to as sciatica. Alright, so how does this anatomy relate to function? So typically anything that closes down those holes, meaning if I bend over backwards, that's actually going to decrease the diameter of that vertebral foramen, and that pinches on that nerve. So anything bending back in this position, even standing, walking, things like that, are going to be aggravating if you have this condition. Now conversely, anything going forward, if I were to bend this spine forward, that opens up those holes. That creates more space for that vertebrae to pass out of. And so those are the positions that these people typically prefer. Now that we have a little bit better understanding of the anatomy, let's show you guys some of my favorite exercises. I've got about 8 or 9 stretches and exercises that I want to run you guys through that you can do right now today that are hopefully going to alleviate some of these DDD and stenosis conditions and help that sciatica to feel a little bit better. Alright, so like with the other videos that I've done, I had to go get my professional model slash physical therapist, exercise demonstrator.
Slash the only one who will help you.
Slash the only other one at home right now. My wife Camille is going to help demonstrate these exercises for you guys. I'm going to walk you through how to do them. Again, we're going to share about 8 of my favorite exercises to help treat your sciatic nerve pain due to this degenerative disc or this stenosis condition that we've talked about. And so the first one she's going to do is lay down on her back. And again, the goal with all of these is to just create a little more space in that vertebral foramen that we mentioned, to open that hole up a little bit wider. So anything that we're going to do to promote flexion, to promote that spine flexion position is going to help to open up those nerves, or open up those holes for those nerves. And so the first exercise she's going to get into is just a simple lumbar rotation stretch. She's laying on her back with her knees bent. She's going to drop both of her knees over to her left side just until she feels a comfortable stretch through the right side. She's going to get that through her right hip and up into her right lower back. Again, keep it comfortable, shouldn't be painful. Hold it there for about 10 seconds. And then she's going to drop both of her knees back this way. Dropping to the right, should feel a stretch through the left and up into the left lower back. Again, 10 seconds to each side, so she's going to hold for about 10 there, and then repeat that 3 to 5 times. Our next exercise is going to be a single knee to chest stretch, and so I'm going to have her kick her right leg out straight. And then all she's going to do is give this left leg a big hug. She's going to pull that knee right up into her chest, hands on the hamstring or hands on the shin. Either way is going to be effective. The goal here again is to create that flexion in your hip to create a little more space in that lower back. If you've got that tightness that goes up through your upper glute, this is going to be a great stretch to help alleviate that. She will hold this for 20 seconds and then she would repeat that on the right side for 20 seconds 3 times. The next stretch, we're just going to jump right into the next one. She's like, you're feeling
I'm
good.
uneven.
She's going to walk around in circles. Next stretch is going to be a double knee to chest. So now she's going to hug both of her knees into her chest. This is kind of a progression to that single knee stretch. We're going to open up even a little bit more flexion. You're going to feel this a little bit more in your lower back. Some people kind of prefer one to the other. That's why I like to demonstrate both. Find which one works for you. Again, a 20-second hold here, about 3 times is what she's going to do. Okay, go ahead and bring your feet down. The next one's going to be a piriformis stretch. You've got a muscle that sits deep to your glute. It's called your piriformis. I'd say 9 people out of 10 who walk into my clinic with low back pain have some tightness in this piriformis muscle. This is a great exercise not only to stretch that piriformis, but to also introduce that lumbar flexion and that kind of that hip rotation that we need. So both knees are bent. She's going to cross her left leg over her right, and then with her hand, she's going to kind of reach down into this gap, hook her right leg right behind her thigh, and then pull her right knee up into her right shoulder. Now the goal here is to feel a stretch on that left side. Again, kind of deep in that glute is where she's going to feel that. 20 seconds, 3 times is a good number to shoot for the piriformis stretch. Now what we're going to do is flip her over into a kind of a crawl position, a kneeling position, and we're going to get into a great yoga pose, is a child's pose. And so she gets down, hands are way out in front, and then she's just going to basically sit down on her heels, kind of tuck your chin down into your chest, and you feel this stretch. Again, we're just trying to round out that spine. We're trying to create space in those intervertebral foramina. And so in this position, she's got this nice open rounded spine. She's going to hang out here for 20 seconds. She's going to do that 3 times. Now this one's a little bit more aggressive, especially if you do have knee pain, to kind of sit down into this position. So just keep that in mind. If this is too aggressive, those single knee to chest and those double knee to chest exercises are good alternatives for this one. Okay, I'm going to flip her back onto her back. And so now again, the idea is that we want to create space for those nerves to exit out of those holes in your spinal cord. And then what we want to do is try to strengthen in that position. It's one thing to kind of stretch to that spot, but what we want to do now is strengthen and stabilize in that position so that it gives you more relief even after the stretch is done. Stretches feel good while you're doing them. strengthening is what's going to help you to feel good kind of throughout the rest of the day and hopefully throughout the rest of your life. And so to do that, what we're going to do first is going to be just a simple posterior pelvic tilt. She's laying on her back right now, and you can see that I can slide my hands underneath her back. That means that her back has that arch in it a little bit that's closing down those holes. What we want to do is open up those holes by introducing a posterior pelvic tilt. So she's going to rock her hips backwards and flatten her back down into the mat. You'll see that now I can't get my hand underneath there because what she has done is actually rocked her hips in this posterior direction to flatten her back down into that spine. Now what she's going to do is activate those muscles in her stomach, and so she's going to contract her abdomen, and she's going to hold that for about a 5-second count. So flatten your back, tighten your tummy, hold that for a 5-second count, and then relax. And then she's going to do it again. She's going to flatten her back, again, rocking her hips backwards, flatten her tummy, so tighten those muscles in your stomach, hold for a 5-second count. And again, what we're doing is we're putting that spine in a more neutral position, so we're opening up those holes, and then we want to train it and stabilize it in that position. The progression to this would be to add some marches to it. So on this, 3 sets of 10, so you do about 10 of these contractions, hold it for about 5 seconds, and then you'll repeat that 3 times. The next progression to this is going to be a posterior pelvic tilt with a march. And so we're going to get into that same position. She's going to rock her hips backwards, she's going to flatten her back, she's going to tighten her tummy. Now what I want her to do is hold that position while we lift this left knee up to my hand, and then right back down, and then the right knee up to my hand, and then back down. And then she's going to relax. And so I like to kind of relax and reset the system, if you will, between each rep. Flatten your back, tighten your tummy up so I can't get my hand under here. Her back's nice and flat to the table. Stomach is nice and tight. March left up to my hand, march right up to my hand, and then relax. Now, as you get stronger and as you are more capable of holding that contraction, we're going to add more and more marches to it. So now she's going to flatten her back, tighten her tummy, hold that contraction, left, right, and now she can relax. I don't want you to hold your breath while you do this. Remember to try to keep breathing. She's notorious for that.
I know.
Keep breathing while you're doing this. Shoot for about 10 marches on each side, 3 times. Our last exercise that I want to show you guys, our last strengthening stabilization exercise, is going to be crunch. Now, those marches that we just did are great for the lower abs. If we want to work on the upper abs as well, again, just trying to strengthen and stabilize that whole system, we're going to do some crunches for that. So what she's going to do is reach both hands down towards her thighs, and then we're going to get into that posterior pelvic tilt position, rock your pelvis back, tighten your tummy up, and then what she's going to do is lift her shoulder blades up off of the table, slide her fingertips to her kneecaps, and then right back down. And so again, we're in this nice neutral spine position. We've got that posterior pelvic tilt, and then she's just going to lift her shoulder blades up off of the spine, sliding those fingertips to her kneecaps. That's how I like to teach crunches. A lot of people will do it with their hands back here behind their head. You have a tendency to kind of crank on your neck a little bit more while you're doing that. You'll see that she's maintaining what we'd call a nice open neck. So I want her face looking straight up at the ceiling. It's not curling forward, creating tension in her neck. And so that's what the crunches look like. Nice. Very good. And so that's it, you guys. About, again, 8 of my favorite exercises and stretches that are going to help you in the treatment and management of that degenerative disc condition, that stenosis condition, and the sciatica that those things can cause. And so I hope you guys enjoyed this video. If you did, go ahead and do me a huge favor, hit that thumbs up button down below, and thank you so much for those likes in advance. Also, if you have any questions about anything that I've discussed in this video, please leave those down below, and I'll get to those comments just as soon as I can. Also, it's a great chance to subscribe to Tone and Tighten if you haven't done so already. Love to see you guys back here for more future videos. And in the meantime, you guys, we'll see you right back here on Tone and Tighten.